In April, President Biden declared an end to the COVID national emergency with the stroke of a pen. Just like that, it was over after more than 3 years. In May, the World Health Organization followed suit, declaring the end of COVID as a global health emergency. Phew. So that means it's over, right? We can enjoy a nice, unmasked sigh of relief. Well, not exactly. Just this week, COVID hospitalizations crossed 20,000 for the first time since March as the new BA.286 variant spreads. Levels of COVID-19 detected in wastewater are climbing back towards April 2020 levels. And even some schools are closing once again due to COVID and flu outbreaks. Mask mandates are making a return to some workplaces and universities. The Biden administration is even set to resume sending out free at-home COVID tests in the coming weeks. Now, of course, to be clear, things are nowhere near as bad as they were in the early apocalyptic days of the pandemic. Death rates are still, thankfully, relatively low. Around 70% of Americans got 2 doses of the vaccine. And though I wish that number were higher, immunity to COVID is much more widespread than it was in 2020 or 2021. But that immunity means little for the COVID long haulers, who number anywhere between 7 million and 23 million Americans. Not only is their protracted battle with long COVID rarely discussed, but it has also made their return to normalcy virtually impossible. Simply put, you may be over COVID, but COVID's not over you. Now, I can give you my assessment all day long, but chances are I'm not your go-to guy when it comes to COVID-19 health updates. For much of the pandemic, the man, the scientist, the doctor we turned to for guidance was, of course, Dr. Anthony Fauci. By the time he was named in 2020 to the Trump White House's COVID-19 task force, he was already legendary in the field of public health, serving 3+ decades as the country's top infectious disease doctor, renowned for his critical role in the fight against AIDS. But in 2020, omnipresent on our TV screens, doing news conferences and media interviews 24/7, he became a household name, a global name, making his way onto the cover of Time, People, and even InStyle magazine. I'm not sure he predicted that one when he finished med school. In a chaotic period where misinformation and disinformation were rampant, Dr. Fauci was the person telling us what to do, what steps to take to stay safe in a once-in-a-century pandemic, and at times having to go against his then boss, President Trump. And so there was the inevitable right-wing backlash. As Republicans tried to brand themselves as the anti-lockdown, anti-mask, even anti-vax party, Fauci quickly, if weirdly, became a target for the far right, a symbol of evil government overreach, the deep state at its worst. Republicans, in particular Senator Rand Paul, embraced the mantra "fire Fauci" and later "prosecute Fauci." But it wasn't just nasty catchphrases. Dr. Fauci also faced death threats. Yes, this public health official in his 80s had to get 24-hour armed guards in the midst of fighting a pandemic. Even today, the GOP is still obsessed with him, and not in a good way. Attacking Dr. Fauci has become a rite of passage for Republicans who want to become president.
As your president, I will never let the deep state bureaucrats lock you down. You bring Fauci in, you sit him down, and you say, "Anthony, you are fired."
Well, even if Governor DeSantis makes it to the Oval Office, which seems increasingly and thankfully unlikely, he won't be able to fire Fauci because Fauci no longer works for the federal government. He retired at the end of 2022 after almost 4 decades as director of the National Institute for Allergy and Infectious Diseases and almost 2 years as chief medical advisor to President Biden. Dr. Anthony Fauci is currently the distinguished university professor at Georgetown, and he joins me now. Thank you so much for coming on the show. Appreciate it. Dr. Fauci, we are seeing a new spike in COVID cases nationwide, a new COVID variant in 10 states. There's that line which I mentioned a moment ago, you may be over COVID, COVID's not over you. Is it fair to say that a lot of smart people have repeatedly predicted the end of COVID, wished it away, but it hasn't gone away?
Well, it hasn't gone away, and I think there have to be the distinction of looking at it as an acute, fulminant, almost tsunami-type crisis that we saw in the early years. As you mentioned in the top of the show, was correct that the number of cases, hospitalizations, and deaths have gone way down, but they haven't disappeared. We're not going to eradicate this virus for sure. We've only eradicated one virus in the history of public health, and that is smallpox. And we've only really eliminated from different regions viruses that have been very troublesome, but that have been controlled by vaccinations like measles and polio. So what we're talking about is control. So when we say COVID is done, it's not done because it's there at a low enough level and there's enough vulnerable people.
Yeah.
And it has the capability, which is really somewhat unusual, not totally unique, but quite unusual, that the same virus in the same season, as it were, because this has been a 3.5-year season, as it were, tends to get variants that elude protection from either prior infection. So what we're seeing now is an uptick in cases, not way up, but enough to tell us that we're not finished with this virus.
So let's talk about immunity. Let's talk about vaccines. We have a new booster just approved, but only around 20% of adults got the last booster.
Yeah.
How do we get those booster rates up when we have not just anti-vax conspiracy theorists, but also our allies in the Western world, in the EU, in Britain, who are saying, well, the new booster's only for over 65s, whereas our CDC here in the US is saying it's for everyone.
Right.
That's confusing.
Yeah. Well, it's confusing because we are talking about the relative degree of benefit from it. When you have vulnerable populations that we have, the elderly, the pregnant individuals, and individuals who have underlying conditions, either immune compromised or underlying medical conditions that make the situation for them worse if they get infected. Those are the ones that get the most bang out of the buck and benefit from the vaccines. However, younger individuals are not completely exempt from getting into trouble, because even though the relative amount of seriousness within that young, otherwise healthy population is much, much lower than the extremes that I spoke about, they can get seriously ill, number one. You want to avoid that and do a risk-benefit ratio of what the risk versus the benefit is. And the risk of these vaccines that have now been given to literally billions of people in the sense of global use of the vaccine is really quite safe. However, there's another thing that you mentioned early on in your introduction, and that's long COVID.
Yeah.
We've got to be careful because there are things about long COVID that we don't yet fully appreciate. And that's one of the reasons why the CDC made what I believe is the correct decision to essentially recommend it for everyone who's eligible. And the reason I think that that's important, Mehdi, is because when you give a message that's very nuanced, it almost becomes garbled. And people say, well, who should be getting vaccinated? If you say, you know, vaccination benefits the elderly and the immune compromised and pregnant women much more than it does young, healthy individuals, that doesn't mean it doesn't have some benefit for everybody.
You mentioned long COVID.
Yeah.
Last year in The Guardian, about a year ago, you called COVID an insidious public health emergency because of its long-term effects. And you said when it comes to long COVID, we're swimming in the dark.
Right.
Your words. Why isn't Congress, why isn't the Biden administration that you were until recently part of, why isn't it doing more to address long COVID when it affects millions of Americans? President Biden, we checked, said the words long COVID, I think, once about 2 years ago, but basically doesn't talk about it ever.
No, they are doing, in fairness, Mehdi, they are doing a bit. And early on, $1.15 billion was given to the NIH to study it. Well, we didn't know anything about it. What we really do need now is we have a special component of HHS that is directly responsible now for coordinating the work.
But correct me if I'm wrong, the NIH program, the main one studying long COVID, just enrolled its first trial participant a couple of weeks ago.
Yeah, no, actually.
That's very late in the day.
No, it is. What the reason for that, and I'm not making excuses for it, but the reason for that is when you don't know anything about what even the proper definition of long COVID, what is it? What are the criteria that separate long COVID from other things that might be confused with long COVID? So you had to have the cohorts. I agree. Clinical trials likely should have been done sooner. Even
and what do you say to long COVID sufferers? I mean, a lot of people who say to me, they contact me and they say, we feel abandoned. Biden doesn't talk about it, the CDC doesn't talk about it. You talked about it last year, but they want to hear more about it. Do you dispute when they say, we feel ignored, abandoned?
Well, they feel ignored, but I want to assure them that they're not. It is very, very much on the radar screen of the NIH, and it is very, very much on the radar screen of HHS. And the president is certainly aware and totally aware that this is a serious problem.
So you advised both Presidents Trump and Biden on COVID. Trump was obsessed with what's been called happy talk, saying COVID's gone when it wasn't gone. But even Joe Biden, on his very first 4th of July, Independence Day 2021, gave a speech while Delta variant was spreading, declaring America close to independence from COVID. And I just wondered, did you tell him that was a mistake at the time, or were you and other public health officials under political, economic pressure to paint a rosy picture?
Well, I can tell you one thing for sure. In the Biden administration, we were never under any political or other types of pressure to say one thing or another. One of the real confusing aspects of it is that at that time, we were getting people vaccinated, and we were hoping that we would reach that 70% very, very quickly of people vaccinated. And even though we knew that there was Delta around, there was the hope that by the time we got to the summer, there would be enough people vaccinated that we would not see that swarm of cases. And that was not the case. We got hit.
So you didn't see it as a mistake at the time because the aspiration, but in hindsight, it was a mistake.
Yes, of course. Well, again, if you look at the president's words carefully, he said we want to be independent, but he did say but.
But you know how political messaging works.
No,
Not every American pores over the exact speech of the president.
I've been caught by that. They don't show the but or the however.
Okay,
but he was very clear.
So let me throw something else at you, much more recent from not in your time in government. You must have seen Jill Biden, the First Lady, got COVID recently.
Yes.
Again, the president, critics say that the president wants to act like COVID's gone and not taking it seriously. Have a watch of this clip of the president after the First Lady got COVID.
They keep telling me because this has to be 10 days or something, I got to keep wearing it, but don't tell them I didn't have it on when I walked in.
Now, I know he's joking. He likes to make a joke. But again, this is a serious disease that is still causing long COVID, still killing people, not as many as before. And a lot of his critics would say there's not enough seriousness about the seriousness of this disease. You have him not wearing a mask. You have the CDC director, the new CDC director, this week was at a senior facility, a facility for seniors, unmasked. And people say that's the president and the director of the CDC. What behavior is being modeled here? Is that fair? Isn't that fair?
You know, it can be confusing, but it is a special situation. You know that the president that day that he made that tested negative. So the chances of the president spreading the infection to anyone else is vanishingly low, You're correct. I'm not going to argue with it that the CDC recommendation is that you should be wearing a mask in indoor places in contact with people for 10 days. I mean, that's the recommendation.
That's the recommendation. You're no longer the chief medical advisor to the president. We can't put that on you. Look, but when you were, at the end of 2021, you defended the CDC guidelines that changed at the time, you'll remember, cutting the isolation period for infected people in the middle of the Omicron surge. And you called it, quote, a prudent and good choice. Even though it came less than a week after Delta Airlines infamously had lobbied the CDC to cut those guidelines. And I have to ask, when we were being told to follow the science, were we at times also following the diktats of big business?
You know, it wasn't the dictates of big business. It's that we didn't really know the full extent. I mean, the science was a moving target, Mehdi. It really was. And I think that's one of the critical issues that, unfortunately and inadvertently, led to some of the skepticism about scientists, because you tend to think of science as absolutely immutable. What's true today is going to be true tomorrow and going to be true a month from now. When you're dealing with math, that's true. You know, 2 and 2 equals 4 today, and 2 and 2 equals going to 4 a year.
Specifically on the Delta thing, you mentioned a moment ago, we were never under political pressure in the Biden administration, specifically, not the Trump, in the Biden administration. But you must have been under economic pressure. Businesses, you know, there was an economic argument to get the economy going. That must have weighed on public health officials.
Well, what are you talking about now? In the early year?
No, I'm talking about even in 2021 when Delta's saying we need to cut these, we need to get people back to work.
No, I have to tell you that economic pressure did not, in the Biden administration certainly, influence any public health issues.
So you're very carefully, I enjoy the way you're choosing your words very carefully, the Biden administration versus the non-Biden administration. So let me ask you straight up. Right now, we Americans are being basically asked to choose between 80-year-old Joe Biden and 77-year-old Donald Trump for president, a lot is being made, as you know, of their age, their mental fitness. And I have to ask you this because you are literally one of a handful of human beings on planet Earth who have worked with both men closely in the Oval Office. And I want to ask you, who do you think is more intellectually or mentally competent, Donald Trump or Joe Biden, from your experience?
Good try, Mehdi. There's no chance I'm going to get into a political discussion.
It's not political. I was asking about their mental competence.
Nice try.
Okay.
Nice try. So I can make a statement.
So the guy who said inject disinfectant into your arms, that guy is not less mentally able.
The one thing I can tell you that I spent 2 years with Joe Biden in the White House, and he is quite mentally sharp.
And Donald Trump?
Yeah, they're both mentally sharp.
Even when he did the disinfectant line, did you think he was mentally sharp that day?
No, there's a difference between mentally sharp and bad judgment. Okay.
Bad judgment is an understatement, Dr. Fauci. I know you're a very polite guy.
Yeah, no,
I mean, put disinfectant in people's.
Yeah, but I can tell you that in my experience for 2 years with the president, he was quite mentally sharp.
Okay. For the first year of the pandemic, let's talk about a big controversy surrounding you.
Right.
For the first year of the pandemic, you were categorical in dismissing the so-called lab leak theory on COVID's origin. You pointed to studies that the virus was most likely zoonotic. It had come out of the wet market from animals to humans. But we now know the scientific consensus wasn't as settled as perhaps we were led to believe. Late last year, you began telling reporters that you have, quote, an open mind on the lab leak theory. So do you regret your earlier public dismissals of the lab leak theory? And would you concede those dismissals fueled mistrust in public health officials?
Yeah. You know, I think if you go back, Mehdi, it wasn't a dismissal. It was my opinion of what I felt was the most likely cause of the outbreak. I had always had an open mind, always had. I didn't articulate, by the way, I have an open mind. I just was very open.
I mean, you went on Newt Gingrich's podcast and said, these are conspiracy theories, Newt.
Well,
and you said in private to Francis Collins, this is a shiny object, referring to the lab, that will go away in times.
Well, no, because, again, you've got to put it into context.
Please, that's why I want to give you a chance to do that.
This is great. It sounds like a congressional hearing where you pull a word out here.
I think I'm a lot fairer and more polite than Rand Paul, but please.
You absolutely are, Mehdi. But you see, it's really in the context. If you look at someone who immediately says it's a lab leak without any data, it's a lab leak, as opposed to looking at the context of going back, the original SARS clearly turned out to be from a bat to an intermediate host to a human. MERS, bat, intermediate host to a human.
I understand, and I'm with you on that.
Oh yeah, but
you referred to the other side of the argument as a conspiracy theory.
No,
was that a mistake? I'm just saying with the benefit of hindsight.
When people make an absolute statement with no evidence whatsoever, I have to question, why are you making that statement? You can say, you know, it's a possibility that it's that, but if you come and say, no, it's this, with no data, so that's the context that gets confused. What I was saying early on was that if you look at the information that you have experienced evolutionary virologists who have no skin in the game. These are people that's what they do with their lives, examine the epidemiologic and other data. They honestly say, no, let me finish, please. They honestly say that it isn't definitive. And that's the reason why we keep an open mind. Once you get a definitive proof, I and all of my colleagues, I assure you, will embrace that.
Do you wish you'd said, I have an open mind in 2020?
I should have been more explicit. I did have an open mind then. So I should have been more explicit.
So let's talk about your open mind, because the GOP is obsessed with you, not just with prosecuting you. They want to put you in prison, right? They say you lied to Congress in 2021 by denying that the NIH had funded what's called gain-of-function research at China's Wuhan Institute of Virology. And in private, they say you were sending emails acknowledging that there was gain-of-function research at Wuhan University. They have an email which they put on the record. I'll let you respond in a moment. And then they say the NIH did fund the Wuhan Institute of Virology. Senator Rand Paul actually wrote a letter to the U.S. attorney in D.C. last month saying all of this. What is your response to that?
He's obsessed. There's no doubt about that. I mean,
He's obsessed. What is your response to this quote-unquote evidence that they've cited?
The issue, if you look at the operative definition of gain-of-function, which is written down not by NIH people, but by a 3-year iterative process involving OSTP, involving the National Academies of Science, involving multiple working groups. The operative definition was that we put aside gain of function because that's so confusing what a gain of function is that any research that needs to be brought up to a greater degree of scrutiny had to be research at that time, the operative definition, that actually was making an enhancement of the pathogenesis or the transmissibility of a pathogen that is highly likely known to be very transmissible, giving morbidity and mortality in humans. And the studies that were done, that were funded through a United States organization with a subaward to EcoHealth Alliance, was looking at bad viruses that have never been shown to infect humans. So by definition, the operative definition of the gain of function of concern, the NIH was not funding that. And that's when I said...
So just to be clear for our viewers, because the viewers and me are not up to this like you are, your position is we did fund the Wuhan Institute of Virology, but we didn't fund gain of function research at the Wuhan Institute. Therefore, you did not lie to Congress. I just want to clarify.
I want to clarify. We did not fund gain of function research according to the operative definition of what gain of function research was.
On just one more on gain of function research before we lose all our viewers. Your critics on the right point to what you wrote in 2012 about the whole field of gain of function research, where you said, and I quote, "In an unlikely but conceivable turn of events, what if that scientist becomes infected with the virus, which leads to an outbreak and ultimately triggers a pandemic," you asked. Before adding that regardless, you believed, quote, "the benefits of such experiments and the resulting knowledge outweigh the risks." A decade later, do you stand by that view?
No. If you're going to do any research that has the possibility of there being danger, it has to be done with the greatest degree of scrutiny of whether it should be done or not. And if it should be done, it has to be done by qualified people under the most important regulated circumstances. That's clearly what Francis Collins and I were on that. I believe that.
It's a 2012 piece for MBio. So do you stand by that? You don't say, actually, in hindsight, I've moved my position.
See, but I think there's, Mehdi, there's a confusion about what gain of function is, and that creates it.
I understand. I'm just saying, but however you define it, I'm not going to get into the definition with you. But you stand by that there is the benefit of such experiments, and the resulting knowledge, these are your words, outweigh the risks.
But you've got to explain what the experiment is. Well, I mean, what is such experiments?
But you're admitting in the piece, to be fair to you, that there are risks, and you're saying as a scientist, I think the risks are outweighed by the benefits. And I'm saying, do you stand by that position?
No, I'm saying...
It's a legitimate position.
You have to evaluate each experiment as to whether the benefit of that experiment outweighs the risk. You can't generically say anything that changes the function. Let me just give you an example. If you outlaw gain of function research, then you're not going to get an influenza vaccine that's grown in eggs. Because in order to get an influenza vaccine that I hope you got and that I got, you likely got it by a virus that was changed a bit to grow more efficiently in eggs so you can get enough of it to make a vaccine. That's gain of function.
Okay. I'm trying to get my flu vaccine with the COVID vaccine, but I can't find a CVS that has one yet. Not a great rollout. Quick last one on this. It's not just Republicans going after you on this. Elon Musk tried to get on the action. He tweeted ridiculously, "My pronouns are prosecute Fauci." Have you dealt with Musk before? What's your response to that?
I never met the guy. I never dealt with him. I have no idea where he was coming from.
Okay, you've been demonized, as I say, on the right in a kind of unhinged, dangerous manner. I just want to play you something that Ron DeSantis said about you last year. Have a listen.
And I'm just sick of seeing him. I know he says he's going to retire. Someone needs to grab that little elf and chuck him across the Potomac.
I mean, I have to ask, do you consider that to be a threat from the governor of Florida? Because to me, it looks like he's inciting violence. I wonder what your reaction is when you hear someone saying you should be attacked.
Well, you know, it's a complicated issue, but I have become, by people who know nothing about me, who don't investigate what I've said I've been done, I become the symbol of what the far-right extremists feel that I'm the one who had to, in an uncomfortable way, I wasn't pleased with that. I wasn't happy to do it, that I had to publicly disagree with the President of the United States. That was very painful for me because I have a great deal of respect for the presidency of the United States. But I felt in order to just maintain my own personal and professional integrity and my responsibility to the American public, I had to say it like it was, and I had to do it publicly. That triggered a degree of negativity towards me on the part of the far right that all of a sudden, when you have anger, in some cases maybe justifiable anger of one ideological group against the other, you need a symbol like somebody has got to be the object of the anger.
But it's not just crazies. I mean, that's a man who wants to be president.
No, but what I'm saying, I'm going to get to that. Okay. What happens is that if you become the symbol of the object of people's anger, even people who know nothing about you know the fact that in my career, I've been involved in saving literally millions of lives that people, hello, forget that, is that I become that symbol. And then when they say something like that, you get somebody who doesn't know anything at all about me, who's crazy, says, wow, I'm going to go get that person, or that person should be killed, or that person should be prosecuted. And that's the reason why I have to have security. Governor DeSantis doesn't personally want to hurt me. He doesn't.
But he's inciting crazy.
He's triggering in people who are bad and really want to hurt people. That's the problem.
It's reckless, irresponsible. I do want to ask one last question, a personal question to you, which is, I do wonder what toll the pandemic took on you personally. You had a crazy busy schedule in 2020, 2021. I saw you, I had you on my show. You were doing interviews 24/7, meetings, news conferences, I'm guessing research, dealing with all this in the middle of mass death, destruction, chaos. And I wonder, you come across as a very cool and calm person to most people. And I just wonder, were there moments where, I don't know, you just lost it, you broke down, it just became too much for you emotionally or mentally?
It never did, and that's just my constitution, that I focus, regardless of the people who think I'm evil, I focus on what my role and my mission is. And my mission is, from the time I became a physician as a young man, is to devote everything I do to the health and the welfare of my patients. And when you're an individual physician in an office, you do everything you can to help your patient. When you become a public health official and someone that was put in the position that I was put in, where you had influence that was not only nationally, but globally, the entire population of the country becomes your patient. So when your patient is sick, it doesn't make a bit of difference how tired you are or how harassed you are. You take care of your patient. So when you saw me sort of working, 4 hours of sleep and not eating and losing weight, I mean, I'm not saying that a hero from that, but that's what you do when you accept the responsibility to take care of your patient.
It's a remarkable attitude. I'm not sure if I have that constitution. Dr. Fauci, thank you so much for joining us on the show today, and we appreciate your 4 decades of service to the country, and I hope you stay safe.
Thank you so much.
Thank you so much.